So coming up again, Russell will be on the stage with Thad Batt as the moderator. Also, some other colleagues from the Office of Information Technology in Colorado, Kate McRoy, and Clayton Hollingshead from the Department of Revenue. Take it away.
Guys. What's up, Thad?
Excellent. Yeah, thank you guys so much for the handoff, and leave it to my colleague Russell to start getting into the weeds about the most complicated integration that we could possibly face with the TSA right at the very end of his allotted time. Good job, Russell.
I tried.
No, of course, that was a great presentation. Clayton and Cassie, thank you guys both for participating in that. It's wonderful to see that footage. I never thought I would get to see Cassie pulled over by the police in real time. So that was excellent. So I'm Thad Batt. I'm a blockchain solutions architect for the state of Colorado in the Governor's Office of Information Technology. And once again, we've got a great panel of subject matter experts with us today. I think we should probably be expecting a late joiner or two as we progress through the conversation. But let's see, since we are starting a new panel, we can go ahead and at least bring up introductions. Russell Castagnero, Digital Transformation Director at OIT, just gave his great product prezo, and much appreciated. Clayton, do you want to go ahead and introduce yourself? Russell didn't give you your required self-introduction time on the last panel.
Oh, that was quite okay. He did a great job. Clayton Hollingshead. I am the program manager for the DMV's mobile driver license program, as well as product owner for digital DMV, where we're trying to move all of our services online to make even more convenient for customer access. So a varied bag of.
Excellent. Thank you. We are I think waiting on Mr. Andrew Bondi to be brought in, who is there he is. Mr. Andrew Bondi, would you like to introduce yourself?
Sure. Afternoon, everyone. My name is Andrew Bondi. I am a senior project manager and project lead for identity resolution out of the Office of EHealth Innovation.
Fantastic. So we are going to be talking about sort of the blockchain technology use cases around digital identity and what it means to our various different agencies in order to sort of get a definition around digital identity and how that impacts each of their areas. For me, it's always been sort of a bullseye of blockchain technology use cases, because almost every other peripheral use case that keeps track of stuff needs that anchor to a person or to a business. Identity sort of spans more than just the individual for me. And I feel like in providing that anchor, it really enables transactional interactions that people need to engage in with both businesses, government agencies, and even with other residents in terms of transferring ownership of a vehicle, for instance. I'd like to get an idea of how our initial rollout of digital identity in Colorado has impacted each of your areas. Andrew, let's talk to you about that first.
Yeah, absolutely. So in the Office of EHealth Innovation, we are very focused on improving health IT as a whole across the entire state of Colorado. And with COVID, the rise of COVID and the disruption of pretty much just everyday life in general, the digital ID and just digital identity in general has really taken the entire field by storm. So it's something as simple as being able to go into a doctor's office and be able to show your driver's license along with the remainder of all your information to be able to get onboarded and begin the HIPAA process and going through all of that work completely disrupted, right? It's to Russell's point, or in the earlier session, right? You're trying to hold up your driver's license to your camera and show your face at the same time, but then you run into the issue that you can't properly sign forms, right? It's you then have to go through, whatever mechanism it is that the office has kind of pulled together randomly to get that taken care of. And so digital ID is really, stepped up in that space, and we've had some partners with the Mental Health Center of Denver, specifically out of our consent management work group in our office, to push that forwards and really speed up the onboarding to individuals that need access to behavioral health and just general mental health services. Additionally, one of the big places we're looking at leveraging digital identity is the ability to be able to enable interoperability between state services. One of the biggest problems and biggest gripes that everybody has, I have it on a regular basis, is whenever you have to interact with another state service and you got to fill out all the exact same paperwork. And then as you fill out paperwork for service A, it's immediately ages, right? It's maybe you move, maybe you have an update to whatever your data is in that regards. When you go over to service B, you fill out the exact same paperwork again, and now it's updated, but now your data between the two services, the system's maintaining that are out of sync. And so we're working with Russell on that space to be able to try and keep all that data in sync and a little bit more under control on the back end of the state systems to enable that better quality interoperability, and ultimately turn it over to the end citizen, the end recipient of the service, to be able to control and manage their profile data and how the state is able to access and share that data around.
That's an absolutely fantastic point, Andrew. Clayton, do you want to maybe speak a little bit to how the digital ID has enabled that sort of real-time data and updating of information, and contrast that to maybe how long it would have taken in the past to get that data refreshed?
Wow. There is a lot there.
Yeah.
Our system currently, the DMV itself has not pushed it out as much as we can, or we're still working with Russell to do so. I think one of the major considerations for the design, from Russell's point, is that we've got to make a cost consideration for adoption for a verification system. And so for law enforcement, for the other agencies that will be using it, how do we minimize the cost of adoption? And I think they've done a great job with the system they've rolled out now. And then as we look forward to the actual MDL, what those costs might be for all sides of the equation, not just law enforcement. But it's very interesting as far as the fact that the driver license was initially just to give someone proof of verification that you're eligible to drive a vehicle, and over time it evolved into our primary identification form. And the information that a highway patrol officer needs is nowhere near the same information that a retail clerk needs or your bartender needs to see. So the ability for the customers to limit the data they're sharing, rather than just give everyone, here's my home address, here's my birth date, full name. So giant privacy consideration, I think, as far as customers able to limit the data they are sharing.
Yeah, that's a great point. Russell, do you want to talk a little bit about how that works? Because I didn't hear about any of that in the earlier prezo.
Sure. So what's already what was part of the initial release was that you could have a filtered view of your ID in the app, and so you could actually hide your address and you could even hide your birth date, and then we just show the whether you're over 18 or not, right? So and this is popular because anybody who's dealt with a creepy bouncer before knows that they can get all that information off of your driver's license. Right, so we carried that over into that consent model that we have for what attributes do we really want to share, and I think some cooler things that we're even talking about is with the DMV is you're making it so you could get on a chat and you could actually confirm that you're the right person with them by scanning a QR code and letting them know that you are that person. They can look up your record and make changes that you're going to need eventually, and another really interesting thing that going back to the bar and restaurant case is there are these books that they make every year on what are the security features and what are all the things of specific driver's licenses all over. And so I remember when I lived in Hawaii, I came up, and aside from the fact that whenever I showed somebody my ID on the mainland, they said, "Oh, McLovin," they would, they would say, "Oh, I don't know if this. I actually went places, and I'm not like a spring chicken." And they would say, "Oh, I don't think this is a legal ID because, it had the wrong band color or something like that." And with an electronic or digital ID, you've got one that can be updated in real time. So when we went to the new format back in, what was it, May, Clayton, I think, everybody was automatically given that new format of driver's license, right? So that went out. When you move from like being under 21 to 21, your driver's license gets converted to the right format immediately. You don't have to go and take a new picture. You don't have to go buy a new ID. None of that has to happen. It happens in real time. From a learner's permit to a driver's license, the same sort of thing. So it really makes things a lot easier on a lot of different levels, whether it's confirming people are who they say they are, or it's using or it's just keeping your own record up to date.
Yeah, that's absolutely right, and I think that sort of serves as a little bit of a on-ramp towards the concept of self-sovereign digital identity, because that's really a lot of the point, is that you only need to share some of the information with the entity or person that has requested it. Having to show your physical ID with all of the information on it really should be a thing of the past. It should be a binary answer to the question, are you of age to purchase X? Yes or no, not necessarily your date of birth, certainly not your home address. So yeah, that is a point well taken, and I think does serve the interest of advancing digital identity towards that self-sovereign goal. Let's see, I think, John, go ahead, Clayton.
As a related point to that, if someone were just pick up your wallet, slide your driver license out, they can then use that driver license for any purchase they want, to do anything they want. But with the driver license or mobile license tied to a phone, you're actually, they'd have to steal your phone. Okay, that's easy. But then they have to open it up, and they have to use your PIN or your biometrics to activate the sharing. So you've got a level of protection there that isn't there with just a physical card that someone can walk away with. And with the digital license, you can turn it off. If it's reported stolen, it can be canceled remotely. With the physical card, it's out there until it's found.
Right. That's a super interesting point. And I think that in striving for perfection, it's often very easy to ignore what the incremental improvements are. And so, when folks discuss all of the failings and problems and issues that might arise with the digital ID, they're sort of forgetting the fact that those are really inherently baked into having a physical ID, and there are a ton more problems. So yeah, great point. I think one of the big aspects that we've talked about, and I think this was a question in the last round about the KYC stuff, is how can that digital ID reduce the friction involved in transactions? And certainly we found that, at least among law enforcement, certainly there was much more of a demand for it once the pandemic came into sort of full effect, and there was a realization that getting up close and physical and exchanging a physical document was definitely not something that was a optimal solution for the police officers, and certainly also for the general public. And I think that there are a ton of different areas that digital ID does reduce that transactional friction. Andrew, do you have any examples of that in your realm?
Yeah, so one of the big things we're actually working on is streamlining the Colorado benefit just application process as a whole, right? So when COVID hit, everybody was becoming, having to go on to unemployment or having to sign up for rental assistance or, utility assistance, things along those lines. One of the big issues, right, is that we were still very much set up to be in a world of you go in and you meet in person with, a county caseworker or, a state representative and be able to work through all the paperwork and the process and the forms in that space. And one of the things that really ended up happening that slowed a lot of that down was that you had to schedule appointments well in advance, right? We were limiting the number of individuals that were allowed to be in a facility at the same time, not only just people coming in, but also, the people that were able to serve, serve the recipients that were signing up for services. And so one of the big things that we're looking at is how can we streamline that onboarding process, right? How can we leverage something like My Colorado to be able to pull in all of that information that is needed, to be able to actually fill out that application, get that all prepared, and then possibly even take you all the way to eventually scheduling an appointment with that caseworker that you can do in, a digital format, you get, over Zoom or, something along those lines, but you can use My Colorado to be able to validate that you are who you say you are on the other side. Right, because that's, again, one of the biggest issues that we have in here of being able to provide state services in general is that ability to be able to truly validate who that individual is and being able to speed up that entire process of getting that information through. And so, the ability to be able to effectively pass data between these state systems to be able to speed up that will also be a huge factor in here. There's a lot in the, especially over in the unemployment space, right? There's a lot that you have to pull in, door information for tax information. You have to bring in Medicaid information. You have to bring in basically all of your benefits information to get that lined up with what's your unemployment payment going to be looking like. And that's all a factor in there. Well, if we don't have the ability to be able to accurately identify you across all of those systems when you're receiving all those various benefits, it just becomes really difficult as a whole. And there's a lot of backtracking and a lot of duplicative entry of information, and then having to confirm that you are who you say you are between all the different systems, and being able to get that unified identity between all of those different services really helps to speed up that process. And it can be as simple as, you go when you need to get access to, energy assistance. You go in and you just click, a button saying, please apply, and it pulls all your information from the other profiles and goes out and hits, the unemployment office or, the different groups that have different parts of the information that needs to come together. And the best part about it is you can consent to all of that in My Colorado, and it can all be captured and it can all be logged, so that in the future, it can be looked up and verified that was indeed what ended up happening. And if you then end up no longer needing to be on that benefit, you can revoke that consent, and that state agency and that program no longer has access to those parts of your data. So it really helps to alleviate some of that Big Brother feeling of, your demographic data is floating around there in pretty much every single database that exists, and really you're in control of that and knowing where it's all at.
Hi, Carrie. Welcome.
Hi, everyone. It sounds like you've solved the state identity, efforts. Where should I take this conversation? What would be helpful? I think I could add a little flavor in a lot of ways, but
yeah, absolutely. If you just want to give yourself a quick introduction and talk about what you do, and then we'll just sort of pick up the conversation where we left off.
Sure. So I'm Carrie Pykoch, the director of the Office of EHealth Innovation. I work really closely with Russell and Andrew on a few identity projects, but our office establishes and leads state health IT strategy. We're steered by a governor-appointed eHealth commission, and we report to the governor and lieutenant governor that are focused on several bold priorities. And for healthcare, that's where we're focused, is saving people money on healthcare and increasing equitable access to affordable and quality care. And so where I can kind of take this is, I think there's a lot of ways that the state is advancing how to better serve our clients and patients across the state, but from an equity perspective, we're really trying to think through, like, even at the simplest level, do people have access to cell phones? Do people have access to broadband and cellular connectivity in their area? And so we've been really trying to advance and advocate and get funding to those areas that don't have that, so that if they choose to use Great State, tools and technology to do that, and that we don't have to worry about filling out paperwork a lot of different ways and a lot of different times. And then from the kind of the broader state and national perspective with identity and access to health information, what we're seeing and what's being driven by policy is that I, as a patient, should have access to my health record when and how I would like that and share it with whomever I want. And that's just simply not the case. There's been a lot of work within our office to encourage use of safe and secure methods of health information exchange, but there's a lot of work to do there. And then how do we leverage new and evolving technologies to accelerate where policy just is still gray? If I'm in a crisis situation and I want to share specific information about my mental health condition or physical condition, how do I do that in a way that isn't incredibly burdensome to the patient as well as to the system at hand? And I think this conference and technologies like blockchain can help us by really thinking about putting the patient or the Coloradan and driving where their information goes. Meanwhile, we'll keep modernizing our systems to get us there.
Absolutely. That's fascinating to talk about what that looks like from the equitability perspective in terms of access not only to the devices themselves, because certainly we do find that mobile devices are prolific throughout, almost all socioeconomic classes at this point. What have you found in your research around what that digital divide looks like? Certainly, I know in terms of access in Colorado, we do have a very strong initiative for broadband access to 100% of Coloradans. That's really one of Governor Polis's objectives, and as we pursue that goal, I think that that might help close that digital divide a little bit. But certainly from a device ownership perspective, have you found anything?
Sure. So I think one prime example is, for example, right now rolling out the vaccine distribution. Much of the information is available on our COVID website, but if you don't have a laptop, access to the internet, you wouldn't know about that. And so where we're seeing kind of slow uptick in some of our rural and more elderly populations is they just don't know about it. So if it's not printed in a newspaper or if someone doesn't call them, they just won't know about that. So although there is a ton of cell phones out there and use of cell phones for a variety of reasons, I don't think that everyone's using them in the same way. One of our projects right now through OHI is to fund rural health providers and get them cell phones and devices in the community so that as they're doing things such as telehealth, telemedicine, vaccine outreach, that there's devices there. Earlier this year in our governor's stimulus package, they carved out $160 million for broadband funds, and out of that, about $20 million for broadband and devices to support telemedicine because of that gap. And I don't have any specific numbers to spout off on the top of my head, but we know that it's still a divide. And even if people do have access to cell phones and laptops, they may not have minutes or funding to pay for said devices. And so we're seeing state funding to help support that with the recent stimulus package through the special session. There was $20 million given to educators to fund hotspots and other devices and help subsidize. And then the federal government's going to be releasing a subsidy to consumers to help pay. I think it's up to $50 per cell phone bill and broadband bill if you can't afford it. And then if you're Native American or live in tribal land, it's up to $75. So I think locally and nationally, we're recognizing that we're all stuck in these square boxes all day. If we're lucky to have work and do service for our state, but if you don't have a consistent broadband or a device to do it on, then it's just not possible. Or you're sharing it with a family, a household of 5, and how do you split up one device across school, education, healthcare, and work all in the same day?
one additional thing I would add on to that is that we also need to remember that not everyone is comfortable with accessing state services in a digital manner. You know, there's a lot of individuals that, I mean, let's be honest, accessing state services is complicated. You know, it's the programs are not always the easiest to navigate. Some of the requirements to be able to accessing state services can be cumbersome to overcome. And when you are, you know, you're not used to dealing or working with that bureaucracy, you know, we'll call it what it is, it's bureaucracy. It's really helpful to be able to have that human element to being able to help guide you through and walk you through that process. And it's just right now, most of our state systems just aren't at that level of being able to help walk people through and guide them in that manner. We're definitely making strides and getting better at it, but having that human element and being able to interact with a caseworker or with you know, a clinician or an individual like that to be able to help you navigate through the process is absolutely huge.
Yeah, great point, Andrew. Thanks. What seem to be the biggest concerns outside of those that perhaps we've already discussed? Some things that come to mind, especially after having watched, let's see, I guess it was maybe 2 panels ago. John Poller had some great remarks regarding sort of the Ethereum community's resistance to sort of government ownership of data and distrust of government ownership of data. So to the extent that we can say, yeah, my Colorado application dumps the data, doesn't maintain anything outside of the traditional chain of custody for that data, people don't necessarily buy that and believe it. How do we address sort of those concerns, I wonder?
Well, I think, you know, a big part of this is setting people's expectations. So right now, the bulk of the connected world gives their information out for free to social media where it's abused. They're victims of identity theft through UI scams or credit, you know, or reach out for new credit cards, or, you know, there's so many different places where people are being scammed. And so strangely, the place where their information is the safest is the government, and where we actually have a responsibility for you know, actually keeping people safe. And I think once everybody realizes that, like with the internet, you know, Pandora's box is open. And all you can do is really choose not to share, or to share judiciously, and have really heavy penalties on those that share without your permission. And adding things like consent and permission schemes that can be implemented in a much more real-time way, and have direct shares coming from an individual to the organization that's asking them, will become the norm, because it is inherently much safer. I mean, right now, if I go to, if I want to get a quote from my insurance company, I've got to send them a copy of my driver's license. They're going to go and they're going to ask like LexisNexis or one of the other companies to go pull my record from the DMV to get my, you know, there are so many hands touching every single one of these data requests. And so there's a bunch of complicated legalese that goes between each of those, but it has to be enforced. And it's always another potential attack vector, right? When you're going directly to that organization, you can know where, you know, you'll know where your information is. It isn't strewn about all over the place. And I think, you know, you've got to choose some way to share. And the answer for the vast majority of the world is not that they're going to have their own wallet that they have custody of, and it's nowhere else, right? And people are going to be backing things up. And, you know, that's not a solution that's going to work broadly anytime soon. So we have to have one where someone is trusted. The group that already has that information is the government, and the government is the first one that's going to be able to get it. Maybe once the government actually executes this stuff, then sovereign identity and owning all of your own information will happen. but still, it'll, once you share that information, it's out of the box. It's out of your control.
Yeah. No, that's an interesting point. And one of the panelists earlier today talked about trying to encourage her friend to start using crypto, and the pushback, and I totally get it now that I've thought about it a little bit more, was that if she was to lose the hardware wallet or her phone that had a software wallet on it, everything would just be gone. Whereas with a credit card, if you lose it, there's somebody to call, right? So you can always get that replaced. I don't think there's a calculus that works for government to make a decision to disregard privacy rules of any sort in favor of profit. Whereas with private companies and businesses, that calculus is there. There's a possibility that it would be more profitable for them to pay the fines for whatever indiscretion happened and earn the money from selling the data.
Yeah, I think that's always a consideration. From the health side, though, currently right now, state or federal government has not been successful at aggregating and sharing, and some would say that that's not the role of government in having access to my own personal health records. And I think there's an innovation opportunity out there to think about within blockchain and various types of evolving technologies. Could there be a trusted provider that could ensure my health record or even my Bitcoin doesn't just automatically disappear at one part? And that might very well be the role of government helping incentivize that. I think in Colorado, the exchange of health information is covered under the Health Information HIPAA, portability, accountability, accessibility. I'm adding an extra A in there. Sorry, Act.
Just
and
don't
so
add an extra P.
P. There we go. See, wah wah. So I think with that guardrail and framework, health providers can't sell your information for capital gain, and that's outside of the rules of that. And as a state, we recognize certain data aggregators that are not-for-profits, known as health information exchanges, to be that connectivity between siloed health providers, so that if you show up in an emergency room, for example, in southern Colorado, that they know you're allergic to penicillin. And if you show up in Denver Health, that they at least have some foundational information. It's at least a step in that direction. And we're at least trying to leverage them and work with our trusted community partners in that regard. And I think governance is an opportunity for individuals that are streaming right now to get engaged from a citizen perspective. We've got a number of public work groups and meetings to talk about how information is accessed and for what purposes. So I think there's lots to dig into around state information sharing, around new technology like My Colorado, and to ensure that you're not getting arrested or there's unintended consequences for having information accessible or available within state infrastructure or apps.
That's great. Thank you so much, Carrie. Let's see, we've got about, what do we have? Maybe 10 minutes left. I think from here, we'd probably like to dig into a little bit more around, with digital ID as an anchor, where might blockchain fit in terms of maintaining transactions that are related back to that digital anchor? So we've talked quite a bit about healthcare from a patient's perspective, but we have not yet touched on blockchain as related to the provider's perspective. So is there a solid use case that involves having that identity anchor mapped out to some form of credentialing? And obviously that's important in the medical world, but also in the education world. And certainly in any professional services that involve state licensing. Russell, do you want to?
Sure. I think that one of the things that Spencer and Taylor's panel, they were talking about was was the use, like in the universal wallet spec that's out there, and so there are some really good approaches to where we could share credentials in a way that is compatible on a cross-wallet basis, right? So, and at the very least, they can be verifiable in real time on a on a non-state system, or not by the issuer, right? If you've done any of these continuing education systems or credentialing systems, that is really important. You've got, like in Colorado, we have the Secretary of State that issues certificates of good standing. It would be relatively straightforward to put those kinds of credentials out there, confirmable and importable into a wallet, to where you could really integrate with that. And that same sort of approach is in one of our bounties, and I think it's in a couple of the Spencer's bounties as well. But that kind of approach is what you can do once you have identity established, and it enables us to do things. You could even sort of come up with the idea of a credential for consent and say, I memorialize this agreement to provide you access to this system until this time, and then you can revoke that at any time and revoke that from that as well, and that can be immediately clear if someone went to go try and verify it. So the technology is there, and we're trying to provide like the safe space to implement that kind of stuff and show the regulators that it's something that's doable, that it's something that will work. And then they can say, okay, well, now we can move our state systems over to that. Right? You can't just do it without having a lot of proof of concepts and a lot of technology demonstrations that show that it really, really works.
Yeah, that's absolutely makes sense, Russell. It feels like there's some great opportunities around consent and around those credentialing to really leverage blockchain in ways that can allow for both providing authentication to a hashed document, but also revoking consent as well.
Yes. Yeah, a revocation of consent. I mean, managing consent now is not something most organizations do well, right? It's normally they take this signed piece of paper and put it and file it away or make an image of it. To be able to allow people to go back and find the consent that they gave and revoke it, that's what we're working with Carrie and Andrew on right now, is actually making that revocable consent model. Even though they, the parties using it don't necessarily have a great way to handle the fact that we could do it, putting it forward might actually save them from some liability issues and things like that. So we're hoping that it will make things a lot easier, and it'll be a huge advantage to all businesses. There's lots of businesses, lots of agencies that need consent.
Yeah, I think that could also end up being a double-edged sword for their liability as well, assuming that blockchain distributed ledger type solution would be there. You would know exactly when consent was granted, exactly when consent was taken away, and what that window was. So encourages more responsibility on behalf of the providers as well.
They better level up.
One of the really interesting use cases that we've been investigating is that from kind of the provider side of looking at that, requesting data from an individual. Let's say we have a healthcare provider is trying to pull up information on an individual, and they're trying to pull it from the DMV. Normally that requires data entry, right? You got a person typing it in, doing all that involved in there. So there's time and energy spent on that. To Russell's point, they're signing HIPAA forms. They put it in a filing cabinet that then eventually ends up in a filing box that ends up in a storage unit somewhere. And so it's that, that management and that handling of all of that really brings it to the forefront for easy lookup, easy access. But more importantly, what it does is to your point of the double-edged sword, it also protects them from the factor that if someone were to revoke their consent to someone having access to their DMV data, the next time that their front desk person or their just system goes to try and pull that DMV data, it's rejected, right? It tries to check the consent to see if they can pull up the DMV data, and oh no, your patient pulled that consent back, and so you no longer have access to it. It kind of flips the script on how are we storing this data instead of having that individual provider storing a full copy of the DMV record available locally, effectively a cache of that for them to be looking that up. It's acquired in more of a real-time manner through some sort of an API layer, integration layer with the DMV or insert system. And that then gets us into this space where we can have real-time checking on that. Every time that they go and say, can I get Thad's driver's license information, or I need Thad's birthday, go and look, has Thad still consented to this? He consented a year ago. The consent has 1 year. Do we need to prompt him again to consent to this? So there's those automatic timeouts on that, the management handling of that consent, and then also the ability to be able to revoke it. And now you have the assurity that as long as that provider is not storing a local copy of that, and instead they're trying to pull it in a real-time manner, they no longer have access to that information. And so you start baking those kinds of ideas into the structure and the way that they're consuming that data, so that you again don't have this sprawl of your individual identity data ending up everywhere and having copies of it, in filing cabinets in pretty much every doctor's office. It's more maintained and managed.
Perfect. Thanks for putting a bow on it, Andrew. And thank you, panelists. All of your input was much appreciated. That was a great conversation. Loved it. And I'm going to flip back over to Matt.